Hi, how are you doing, Melissa? Where am I sitting? Am I sitting next to you, John?
Sure, wherever you
Hi,
want.
John.
Hi, how are you?
Good. Thank you. I'm going to the ladies' room. Hey, Sean. Move down there. Oh, yeah.
Great. Good evening, everyone. My name is Rosemary Hall, and I'm Chair of the Delaware County Board of Health. Welcome to our meeting today. I do want to begin the meeting just with a quick reminder that tonight's meeting of the Delaware County Board of Health allows public input and comment, and it's important to the Board of Health and the mission of the Delaware County Health Department. This is a public meeting and being held pursuant to the Pennsylvania Sunshine Act. As such, there will be 2 opportunities for public comment. One at the beginning of the meeting, limited to comment on the items on tonight's agenda, and one at the end on any topic. Comment is limited to 3 minutes per person and will be monitored by the solicitor of the board. This is a public meeting, but not a town hall or a question and answer session. And we ask that outside of these 2 opportunities for public comment, that you please refrain from asking questions or otherwise making comments to the board. You may ask questions during the 2 opportunities for public comment, but the board members and other presenters are not required to answer. Thank you. My other announcement tonight is that we did have a Board of Health executive session to discuss personnel issues and the litigation. And we will be discussing the 2023 calendar at our next meeting for approval. And that is all the chair announcements today. And at this time, I would like to make public comment. You're able to make public comment on the agenda items if anybody would wish to do so at this time. Okay, seeing no one, we'll move on to the next agenda item. This time, I would like the approval of the minutes from the prior meeting, and I would need a motion to do so. Motion to approve?
Second.
Lily. And all in favor?
Aye.
Hi.
And no opposed. Okay, the approval of the minutes has been noted. And now we have our board updates by the Delaware County Health Department Director Melissa Lyon.
Thank you. It's a pleasure to see everyone this evening. I just have a few items that I wanted to review with you regarding some of our most important or most pressing topics that have been occurring over the past couple of months since we last met. So I'm going to sort of go in the good news of what we do. So grants have been received and fully executed. So we have the immunization grant has been received and fully executed. Tuberculosis grant has been received and fully executed, and our maternal child health grant fully executed. There will be a 4th grant. The HIV grant will be on council's meeting this coming Tuesday and Wednesday, and that one would expected to be fully executed. They've been built into the budgets as I demonstrated in our last meeting, and it's a little over $1 million and a couple, like $1.2 million roughly. So that's the great news. Those dollars then get used to complete our fundamental public health requirements from the State Department of Health. This comes from the CDC and block grants that come through, and it says in order to be a health department, you need to be able to do this amount of work related to all 4 of those grants. So good news is we're moving in that direction. Second, I'm going to jump to monkeypox. So we all know that monkeypox is now present in our country and around the world, and Delaware County is also experiencing cases. So as of August 27th, we've had 17 cases. We've also worked closely with the State Department of Health to identify their contacts and do the contact tracing to then get those individuals that have been at high risk for potential of developing monkeypox vaccinations and or treatment, depending on where we find them in their disease state, if any. That work is, all of the vaccinations have been occurring at the Delaware County Department of Health. We are working to have an additional community partner be able to offer those vaccines as well. It moved from the subcutaneous to intradermal. So now that we have gone from sub-Q administering of those vaccines to the intradermal, we actually have more vaccine available. So with that, we've been talking about strategizing how we may be able to offer up vaccine more widely. Interesting, we just learned yesterday that we are asking about distributing our monkeypox vaccine to community partners so that we have more touch points in the community for those that would like to receive monkeypox vaccine. But we wanted to know what additional vaccine we'd be eligible for or to be able to receive. And we recently found out that the state health department has to demonstrate that they've used nearly 85% of their vaccine before they can order more to be available for us. So I'm prefacing that because I think we'll be talking about where we'll be strategizing to get vaccine out to our community partners, as well as offering up more broadly to our high-risk populations. And then the third thing I wanted to give an update on, which is like hot off the press this morning, was the bivalent COVID-19 vaccine that then will be available for individuals that voluntarily would like to receive that booster vaccine. And the Delaware County Health Department does not currently have vaccine on site. When the next option to order a bivalent vaccine becomes available to the Delaware County Health Department, we will be submitting a request for that vaccine. The interesting part is we're no longer able to offer the monovalent for the booster. So anyone that had been scheduled for a booster using monovalent, we're having to reschedule them and then bring them in at a time that we're hoping to have the bivalent if they'd like to, or we can ask them if they would like to go to one of the federal partners and pharmacies where they could get it before, since we don't have it available to us. So it's going to be a little bit of work for the team, but that we were not, I'll be honest, it was interesting to learn about not being able to use monovalent vaccine. It was in the communication today. So I did not have, nor did the team have any advance notice on that.
How much work are you gonna have to do to notify people that they can't get them on?
It's pretty streamlined as far as how they're scheduling. I think it will take a few days. We don't book out too far, so it shouldn't be terribly difficult to get them rescheduled as long as we're able to reach them. I'm almost anticipating that we may not be able to reach everyone, and they may show up at our door, which then ends up being a disappointment because they, invested resources to get there. I think those are things that concern me as our public health messaging and how we're showing up in the community. The other part of that question, let's see, I wanted to say, I don't think it'll be a heavy lift there. Oh, it's not knowing how many walk-ins we may have. So those vaccine clinics have been we spent a lot of time really getting our communication, out there. And now we're almost retracting this communication, unfortunately, because we won't be able to offer vaccine right now. So I'm a little, we'll have to, I think our front door presence is where, we'll have to, I'm looking at Stephanie only because it's in Yaden in particular and Chester, where we'll have to be present and be ready for that, which it's not great. It puts us in a position that our messaging is going to once again sort of not be consistent maybe with how we've been presenting in the community. And that's across the board. It's not a Delaware County Health Department uniqueness. It's happening to every one of the health departments across the country. Does that help answer your question, PJ? Yeah.
I do have a question. This is a booster, the bivalent for booster. You could still use the monovalent for first.
That's correct. That's correct. But we're not seeing a lot of first dose requests in our clinics right now. Most of them have been boosters.
It's just any place where any indication for the bivalent you can't use the monovalent.
Correct. Other questions?
Yeah, and just for, kind of connected to this, like the call center, has there been an increase in questions to the call center?
Yeah, so that was great. So the call centers received like over 3,000 calls and, since April. And the three hottest topics that we're getting, COVID clearly has been our most prevalent sort of questions, everything from vaccine to where did we get tested to what is the newest guidance? We have an outbreak. What do you help us navigate? So we just sort of lump COVID. The second would be environmental and complaints, or we have this thing that we're worried about, whether it's restaurant related or garbage related, or we call them nuisance complaints. Second, and then third would be the monkeypox. Just a lot of people wanting more information, who's eligible, am I at risk, where do I get vaccine, when's vaccine available, and the team's handling it with, I actually met with the team today, I went back where they're working and was nice to touch base with them. They're doing a great job sort of navigating this on the fly. So like today we had to get them as much information as we could about, the bivalent vaccine booster. So they're doing a great job, but it's a challenging environment for sure.
So the complaints aren't a nuisance, the issues are a nuisance.
Yes, correct.
I wanted to ask, we're going to be administering the bivalent concurrently, or the monovalent where appropriate, concurrently with flu vaccine when we're.
Great question around when we're doing our flu vaccine clinics as well as COVID clinics. Right now, we do not have flu vaccine on hand either. That is in the process of ordering. And then the amount that we'll have, I think, will be determined on how much we can order. And then our ability to pre-plan this. Ultimately, it would be ideal if we can offer both at the same time, though at this point, I'm not making any promises one way or the other if they can both be offered. That the team hopes to have that in place. There's just still some logistics that have to get worked out. And it wasn't best I can offer right now.
I heard on the radio a few weeks ago about Delaware County Health Department still doing vaccinations at the SEPTA terminal. Is that going to still happen in the fall?
Yeah, so that has been a very successful site for us. We've had a number of, it's just been consistent flow and traffic. The team likes that work in particular. It reaches a population that I think is very rewarding for the team. So yeah, we're going to continue to do the work there.
Anybody else have any questions?
Okay.
Did you want to do you have yours? Did you have
Sorry,
do you have
the presentation?
Mhm.
Yeah, and I was gonna do it from the podium. I'm gonna feel, but I just feel, I'm gonna feel better doing it from the podium, facing it.
Sounds good.
Okay. So. This one on, Sean. Are you gonna advance the slides for me, Sean? Okay, grand. So this presentation was put together for the National Association for City and County Health Officials when they asked if Delaware County Health Department would be willing to present at their conference. Really, what is it like to do a startup public health department during a pandemic, as well as interweaving the concepts of a 21st century public health model and public health 3.0, which really incorporates equity and social determinants of health and really addressing the root cause of our health disparities or our poor health outcomes, whether I'm talking about Delaware County or the country. So I hesitantly agreed because I felt that we were so new that I wasn't sure that the Delaware County Health Department would have something to offer at the conference based around this topic. But I did agree to do it. So I thought this would be really great for the community to learn about, as well as you on the board. And then my team liked it when I presented it at the staff meeting. And I thought this would help everyone understand where we currently are. So I started the presentation talking about the mission, vision, and values, and the mission and the vision and the values look very similar to many health departments across the country. I don't need to read them to you, but ultimately we're talking about the idea of allowing everyone to lead the most healthy and productive life that they can in Delaware County. and that this is done through our leadership, prevention, response, and partnership within the community, which is a huge component of Public Health 3.0, is engaging the community in what you need to accomplish. And then our values are clearly centered around equity, collaboration, leadership, accountability, innovation, and stewardship, which I go into more detail in the next few slides. So I wanted to give credit where credit was due on all of you that are sitting here today as the Board of Health, those of you that were on a steering committee early on, and the 15 years prior to the establishment and the grassroots efforts that happened here in Delaware County to end up being where we are today. So I discussed the concept that many of you have been very involved with wanting to be on the policy advocacy and the grassroots efforts for 15 plus years. I know this goes back quite some time. And that the steering committee that was part of the early formation was incredibly committed to the Public Health 3.0 model and wanting the health department to function as really the chief health strategist. So how we help bring together community partners, stakeholders to determine what are the goals that we're going to be accomplishing and how do we achieve those. That's what the health department will be doing. And how you accomplish this within the steering committee is you held many listening sessions, as well as having a huge focus on health equity. Hiring and early training considerations were intentional and well implemented. And then local data and health and all policies. And so ultimately, I was demonstrating to those in the audience that we really had a focus on what Public Health 3.0 was going to be for Delaware County. We know, go back one more, Sean, quickly. So the pandemic exposed those gaps to around local public health. We all understood that we were under-resourced, understaffed to be able to respond to a pandemic, and the magnitude in Delaware County was probably experienced that more than any other county, maybe in the nation in many instances. And then I rolled into the idea that public health foundational services, Act 315 and Act 12, really require three components. They require the administration division, the environmental division, and community health services. And that is the only foundation that we have from which to build, are those three things. But there's still a strong desire to incorporate, and this is real time right now. I know that there are agencies and entities that want us to address environmental justice and violence prevention and housing and food insecurity. And while we're on that same trajectory and we want to get there, the three things we have to accomplish really well is administration, environmental health, and community health services. Next slide. So I just put this into a visual that demonstrated the Board of Health's commitment to health equity and all of the steering committee leadership. The leadership's commitment to Public Health 3.0, that's all of us here in the department that have showed up here today for this meeting. Then there's the state mandates in the public health foundational services, and then the 15 years of advocacy. So those four things are pouring into what's going to create our Delaware County Health Department. Next slide, please. So where are we really? So we need to have an infrastructure, we need to have staff, we need to have funds, and we need to have appropriate stakeholder support. And so I was explaining that the infrastructure is not just what happens in Delaware County Health Department, it's also the infrastructure of county government offices. We need to have human resources, purchasing, fleet, budget, revenue, all on the same page to drive the Delaware County Health Department to the direction of having a stable foundation. That includes buildings and leases, policies, processes, and procedures. So we're spending quite a lot of time in this infrastructure stage. We are 5 months, soon to be 6 months old. We were established in April. We are 5 months, 6 months old. We wouldn't expect a lot from an infant at 6 months of age. We really wouldn't. Like, they're just learning to roll over and maybe push themselves up, barely crawling. And so I really wanted to demonstrate, like, we're here. This is where we are. Staffing is the next part, is we've had rapid staffing and onboarding. This was grown out of the emergency response. You all knew, you lived it. I'm looking at all of you in this room that did that. And so there was an emergency, this critical component to get this up and going. So we did that. However, the morale and the retention of staff has been challenging. Some of that is people that love to be part of a crisis response. They have a really unique skill set. Those that want to be part of the day-to-day operations of public health may not be the same people that have the emergency response passion. And so we are really sussing out or working with the staff, like, is this a good fit for you? It was a good fit in the emergency response efforts, but maybe it's not a good fit in a day-to-day operations, the grind, I would like to say, of like what the public health department is responsible for. And then I put in here inexperience. It's not to be derogatory or demoralizing or negative at all, but the amount of staff that we hired and onboarded quickly, very few of them have actually worked in local public health, local government public health. It's a unique entity, and with it comes challenges. They have maybe many expectations of what they've learned in their masters in public health and, you know, all that exciting work that you get in the classroom. But when you're actually in a government public health setting, it doesn't necessarily flow as quickly or as easy or as smoothly as it's projected in a textbook. The only way to get experience is to do the work. This is what happens. So the funds I talked about using the American Rescue Plan Act, ARPA dollars to help portion of this funding. And then I talked about putting together the 5-year budget proposal, and you all received that at the last meeting, demonstrating what we'll be using for the upcoming year and then hopefully the next 4 years. I don't anticipate that budget to change much if all stays stable and as I can predict, but we all know that planning assumptions change year to year. And then I wanted to acknowledge that we had huge support from council members, municipality, residents have expectations of us, private sector and philanthropic entities have expectations of us. And honestly, I'm still on a day-to-day basis trying to level set. Does everyone have an expectation that meets the reality of where we are today? Because our day-to-day operations behind the scenes, the expectations may not align. So a lot of times I'm saying a philanthropic operation may want to give us money for a project that they think is really important, but we may not have the infrastructure or the capacity right now to accept that money and move forward on that project that they think is really important. We will into the future. But as we sit right now, it would almost be a burden to be distracted from building that infrastructure and trying to do a really innovative program. So we have some competing priorities internally. Our heart and our passion says, yes, we want to go that direction. But until we get the infrastructure in place and we're really doing that fundamental public health services, we can't move forward. Next slide, please. So I describe it in Maslow's hierarchy of needs. So this is my favorite slide of my presentation. Is I wanted to talk about like the physiological components of building a health department. We need to have our funding, our buildings. I need to make sure staff is paid appropriately, that they have their benefits, that they're confident and they know that every day when they come to work, there's some consistency in what's happening. The next level is safety. So safety, I translated that into, we need to have clear policies and procedures and processes, roles and responsibilities well defined. They need to know, like, this is my day-to-day job. When I come in right now, this is what I'm responsible for doing. We're still working some of that out. Some of those things are not always clear on the day-to-day. Love and belonging, I translated that into, we have to have a team that functions well together. They are cross-divisional. They have respect for one another, and they have multidisciplinary work. And that's really beginning to start to gel just sort of organically among the team. Very proud of the work that's happening there. Esteem is then we're delivering our foundational public health services. I feel like every day, like it's our just routine, no worries. It's what we do. We've got it. Nothing changes. We're cooking there. And then I said self-actualization. That's where we can be high functioning. That's where we're going to get our accreditation. We'll be that chief health strategist, and we'll be delivering public health 3.0 services. So I put it in this Maslow's hierarchy of needs. Next slide. And then I just detailed what it is that we're expected to do for our key services in 2022. You've heard about most all of this. There's nothing here that should be surprising to anyone, but it's really foundational public health services. You're not seeing a lot of health equity right here, right now. You're not seeing a lot of health in all policies right now. You're not seeing a lot of community engagement in any of these bullet points right now, because this is the stuff that needs to be accomplished before we can get to that next step. Next slide. That's the team. Of course, I said we need to update that picture. I love the picture. It shows the diversity, how intentional we were to really make the team look like the community that we're serving. And I think the next one was just a thank you. So, and I'm happy to take questions if you want. I'll stay at the podium if you have them.
If you like, you're progressing at the pace you anticipated?
So
In the development of the department?
yeah, I mean, it's a great question. So, are we advancing at the pace that that I thought? There are parts of it we're advancing quite quickly and rapidly, and there are other areas where it's been a little slower and more of a slog. And it depends. So some of it is hiring the right people at the right time with the right skills. So instead of bringing in someone that may not have the skills that we're looking for, we're trying to be very intentional to prevent turnover. We just talked about it today. We may have someone that's overqualified for the position. So the question is, do we bring them in overqualified, knowing that we don't necessarily maybe have those advancements that individual would be wanting in order to stay, and we may jeopardize and lose them. But is that a risk we're willing to take? Did we interview well? Did we ask those right questions? But as far as keeping up with the communicable infectious diseases, absolutely. Being able to meet the demands and questions of the community. Absolutely. Responding quickly to requests from stakeholders, whether it's a yes, we can help, or no, we'll come back to you in a couple of months. I mean, yes, I'm hoping that we're delivering the demand of the services that are being asked of us right now.
Thank you.
Yeah, you're welcome.
Mine's just more actually a comment and
Mhm.
recognizing that, your challenges in hiring are not just happening in the health department, they're happening across the county and across, the region. So, I recognize how difficult that is, and hopefully, the county resources can help you
Yeah.
be able to attract more of the.
Yeah,
people
thank
that-
you. I appreciate that. Yeah, you're right. I mean, we know that the expectations of those that are employable have definitely changed like throughout the pandemic, and rightfully so in many ways, but it has put challenges. And I've been saying, we are people serving people in a startup phase. And so the opportunity to have a hybrid or remote work policy has been really challenging, because we have to build a team, and it's hard to build a team over Zoom. I'm gonna tell you, it's just difficult. Like, maybe if you were a team that worked really well together pre-pandemic, that can still foster across the virtual platform. But as you're bringing in new people, it's just not the same. And so asking for some in-person work for a period of time has also been limiting our pool of candidates that are willing to accept the position. Other questions?
Thank you. That was a great presentation.
Yeah, you're welcome. Thank you for letting me present.
Okay, and at this time, we do have our new business, which would be our division reports. So I just wanted to check if there was any questions from the board members on the division reports that you had received ahead of time. Everybody good?
No question.
I may have a question to the board. One of the concepts behind putting together the Board of Health division report prior to the meeting was to give you as much information as possible prior to coming to the meeting, so that if you had particular questions, or you wanted to have a presentation on something, or you wanted a deeper dive on any one of those topics, you would let us know ahead of time, and I'll pull the right staff to make that happen. Sort of as I presented today, it might be a division administrator. It may be someone that's actually working in the field in that area. So my question would be, I think this is our second one. I mean, is this mechanism working for that right now?
I think so, yeah.
If we could see it a little earlier.
Okay. Noted. Yeah, no, agreed. Would you like it 2 weeks in advance?
That would be plenty of time, even a week would be.
Okay. Yeah, I think we sent it on Monday. We typically would have sent it on a Friday. My goal is to send it out the Friday before this meeting. So you would actually have it over a weekend as well, because I know you have busy jobs.
Yeah, I think that would be appropriate.
Noted, team.
Yeah.
Thank you for the reports. They were informative.
You all did a wonderful job. It just reminds me of how busy you are every day.
Yep.
Okay, at this time, if we have no other questions on our reports, I was going to move to public comment. And this is an opportunity for anybody joining us this evening to make public comment.
When you come up, please give your name and your street address. Thank you.
Patty McIntyre, 215 Cherry Hill Lane. I don't have a whole lot to say, but, and I know you're beginning and you're starting and but all I'm hearing is about vaccine clinics, and I guess in our times, that's a prevalent thing. And I do notice on the website, there's lots of information about health and nutrition and that, and I'm looking forward in the future to see more and having more. So thank you.
Then thank you. And I'd like to make a response if you don't mind is, in absence of us not having those programs well established or well developed that we can roll out to the community, we have information available on our website that may seem benign and not all that useful right now, but we didn't want there to be this absence of some information. So it's noted and it's acknowledged, and I'm excited about the work that we'll be doing in that space. It's really where my passion lies across the board. Unfortunately, there are just some real fundamental things that just have to get into place that we need to be doing. And so I appreciate it. It's noted, and we'll be moving in that direction. Thanks.
Bill McIntyre, 215 Cherry Hill Lane, Broomall, Pennsylvania. Listening to what you were discussing about staffing, I was in the staffing business for 40 years. And what I find is that new companies or new departments, they're focused on so many different things that they aren't specialized in staffing. There are a number of staffing companies located in Delaware County, and they might really benefit you because if you're giving them exactly what you need, they'll be able to find those people and you try them. And then you know, that headache out of the way, you're able to focus on the next emergency that's coming up. So again, I know hiring, it can be very, very difficult. But again, there are people, that's their business. They have contacts in the community and they can really help startups. Okay, thanks. Okay.
Thank you. I think that's very helpful. Anyone else? Okay. Not seeing any additional public comment. I'm going to note that our next meeting will be on November 3rd, 2022. And at this time, I'll call for a motion for adjournment.
Second.
Okay. All in favor?
Aye.
Aye. None opposed? And we're officially adjourned.